Hello everyone. So in today's video we are going to be talking about introduction of liposomes. So rational research in drug delivery began in 1950s with the advent of polyclonal anti-tumor antibodies developed for tumor targeting of cytotoxic drugs to experimental tumors. So this is how the drug delivery uh, approach toward drug delivery had begun. So this had targeted a series of concerted efforts evolved with the emergence of a plethora of delivery systems. Liposomes were discovered in the early 1960s by Beghams and colleagues, and subsequently became the most extensively explored drug delivery system. However, it took several years from the early to the late 60s before the system was realized as a potential drug carrier. At the first, they were used to study in vivo stimulated biomembrane behaviors, like they were used to study membranes of the living organisms and how they behave under different conditions. So, subsequent to that, liposome has become an essential therapeutic tool, most notable in drug delivery and targeting. Not surprisingly, liposomes have covered predominantly medical, albeit some non-medical areas like bioreactors, catalysts, uh, and cosmetics and ecology. However, their performance in drug delivery and targeting has enabled them to be used as therapeutic tools in fields like tumor targeting, genes and antisense therapy, genetic vaccinations, and immunomodulation, lung therapeutics, fungal infections, skincare, and topical cosmetic products. So they are widely used in different areas of science. So structurally, liposomes are concentrically bilayered vesicles in which an aqueous volume is entirely enclosed, like they are entrapping some liquid inside them. So they are enclosed, that liquid is enclosed by a membranous lipid bilayer, mainly composed of natural or synthetic phospholipids. phospholipids. This chapter deals with the formulation, characterization, in vivo, in vitro disposition, and therapeutic application of this versatile delivery system. So we are going to discuss all these things one by one in this chapter. So now, what are the advantages of this system or this delivery system? So if we talk about advantages of liposomes, first of all, it provides a selective passive targeting to tumor tissues. And next is it increases the efficacy and therapeutic index. Why it does so? Because we know that we are going to uh, be enclosing our drug in that liposome. So it will be more effective and it will have less side effects. So therapeutic index will be decreased and therapeutic index will be increased and efficacy along with that will also be increased. So now as they are encapsulated, their stability is also increased. Reduction in toxicity of the encapsulated agents and site avoidance effect. Like if you do not want their effect on some specific organ, that will be avoided because that drug is now enclosed. It will not have effect on that organ. Now there are improved pharmacokinetic effects of those drugs because there is reduced elimination and increased circulation lifetime. Flexibility of to couple with site specific ligand to achieve active targeting. Now you want that drug to go to a certain place to have its effect. So that thing will be enhanced. So your efficacy will be enhanced. So in next video, we will be talking about mechanism of liposome formation.